Janet is here today along with cardiologist Dr. John Kennedy. Welcome to you both.
Thank you.
And we want to talk about heart disease because it's so very common. And Dr. Kennedy, I want to talk briefly with everyone at home because heart disease is a catch-all phrase. And under heart disease, there are many different subsets. And I'm going to show everyone at home what a normal heart looks like. And if we can got to get really close here. I'm going to show you one branch of, this is a coronary artery here. Does everyone see that? And it branches off almost like a stream or a creek might be, right down through here. So there are many arteries that lay on the surface of your heart, and they supply precious oxygen to your heart muscle so that it can do its job. But some people over time, whether it's due to high blood pressure or coronary artery disease, can develop heart failure. This is a heart that's about 3 times the size of what it should be. This is someone who is suffering from high blood pressure. It's heavy. Have you ever felt a heart?
No.
Do you want to?
Sure.
Tell you what, I'm going to have you grab these gloves. I don't want to. Dr. Kennedy, I know you've held many hearts in your hands. So. But I think people, and you could agree or disagree with me, but I think a lot of people, they don't think about their heart until it's too late because you don't see it. You don't feel it.
That's right, Travis. And, really, I want to thank Janet for coming to me because, women are still underdiagnosed and undertreated. And Janet was concerned. She was worried about her father passing away from heart disease, her grandfather. And her subtle symptoms might be, life-saving. So it's incredibly important to understand that for 50% of women, their first time presenting is with either a heart attack or sudden cardiac arrest.
Preventative measures are absolutely key with heart disease. If your heart is healthy and you take appropriate measures early on, you can prevent heart disease from progressing. Now, this new technology you use for Jan's pretty cool. What is it and who could benefit from it?
It's an amazing new technology. It's called cardiac CT, which includes angiography. And cardiac CT is probably the most accurate test we have for testing women for blocked coronary arteries. And that's important because 70% of exercise treadmill tests, for example, are inaccurate. And a lot of times we'll say, hey, this stress test is abnormal, which leads to a number of unnecessary and potentially risky studies. And sometimes we say, hey, these tests are normal when in fact there are blocked arteries. Cardiac CT angiography gets rid of all those problems and makes the diagnosis correctly in greater than 98% of the time.
So the radiation's less than that of, say, a full-body CT scan. And what we learned from your CT scan is a lot of information about your coronary arteries. And you okay if we go show you?
Yes.
What the results showed?